So our next speaker for today evening is Ms. Anupama Joshi. She's Executive Director, Blue Sky Funders Forum, USA. And Anupama Joshi has pursued her BSc and MSc from Department of Foods and Nutrition, MSU. As we can see, her professional profile shows that she has been working at various places from India, AIMS, beginning from India, AIMS, then NDDB, India, Pesticide Action Network in Malaysia, Food and Agricultural Organization of the UN, Thailand, Occidental College, USA, and founder and past executive director, National Farm to School Network from 2007 to 18, almost 11 years. She has carried out a lot of community engagement work as co-author for Food Justice, Community Food Systems Mentor from 2018 to present, as Board of Directors, Farmers Market Coalition, past board member Food Corps, and Community Alliance with Family Farmers. So without taking much time, I would request Anupama Joshi ma'am to share her screen and start her presentation. We welcome you, ma'am.
Okay. Good evening, everybody, and good morning from the East Coast of the United States. It's really a pleasure to be here today, and I want to thank the Department of Food and Nutrition as well as the Alumni Association for this opportunity. It's really a wonderful opportunity to connect with students and alumni from the department. It's been more than 30 years or so probably that I have. So the theme of my talk today is on collaborations across different sectors and network building. In almost the 30 years of work experience that I have, I found myself breaking down silos constantly across different sectors to find common ground for the changes that we aspire in society, and hence the theme of this talk. This webinar also sort of aligns with the Food and Nutrition Department's mission and vision that Dr. Mehan shared earlier in terms of cross-sector collaborations and the strategies for systems change, for research, for partnerships, advocacy, and capacity building. Public health nutrition in general is an interdisciplinary field to begin with. So I think we are at an advantage of connecting with different sectors and trying to make change that is really lasting change that benefits the community. Social change and innovation, I feel, happens when we seek out intersectionalities and kind of look for systems change efforts that need to happen. Each of the sectors, just like the ropes of these different colors that you're seeing on the screen, are pushing and pulling and influencing your outcomes. And when they all work together, the common knot that you see in the center is much stronger. So I'm hoping that I'll be able to sort of give you a sense of how that is possible, in the work that I've done. So my goal today is to illustrate the power of networks and cross-sector partnerships to further the goals of public health nutrition. I'm happy to take questions after the talk, and you can also use the chat box. I'm not able to see the chat box right now in screen share mode, but I would be happy to answer questions once I'm done with my talk. All right, so let's begin. So the best part of doing work related to food and by extension public health nutrition is that everyone eats and everyone understand what it means to have good food together, to break bread together. And food, I feel, really truly connects so many sectors that opportunities for collaboration are abound. You can have so much cross-sector collaboration because of food and public health connection and work that you're doing. So going counterclockwise, just wanted to give you a couple of examples that public health nutrition and food systems work should consider. Questions like, where does food come from? Where and how is food grown and how is it transported? Are the farmers that are growing the food getting fair wages? So sort of a social and racial justice angle to it. Who is accessing good food? And you can define sort of good food as healthy, green, fair, and affordable. Dr. Mehan also talked about reaching the unreached being a part of the strategy that the department has. I mean, so there's really a component of sort of social justice and and equity that is inherent in the work that the department does. And I'll show you that that has been a center point of the work that I've done as well. So food is a career choice for youth. Food is an economic driver. And then what role does food play in cognitive development and learning? So the connections with the education sector are really important as well to consider. So as you can see, there's lots of different sectors that are possible for connecting with food and public health lens and work. And I'm really happy to share some examples with you. So I'm now going to share and illustrate these connections with you with using 2 case studies from my work in the United States. One as part of a nonprofit organization that I founded, and the other from the influence of philanthropy or from the vantage point of funders who I currently work with. So the context for my first case study, I wanted to give you a little more context. In the United States, about 10, 15 years back, when I started this work, there was a growing public conversation and interest in local foods and sustainable agriculture. There was sort of a convenience food culture that was, that was present, and people were wanting to get away from that. Kids or students in schools and even parents, I think sometimes adults, were so disconnected with the source of their food that I've heard people say things like milk comes from a carton, not a cow. And so there was sort of a feeling that there were connections with the source of food that were needed, that was needed for people to understand the importance of food. And then there was an emerging interest and understanding of the justice and equity issues in the food system as well. I mentioned who has access to good food. Are farmers being paid a fair price or not? Those are questions that there was an interest in the U.S. public about digging deeper into those. And lastly, an obesity crisis was kind of starting to happen, not just in the US, but also globally. And for the first time in the United States, there was conversation about children not outliving their parents due to diet and obesity-related diseases. So I think this was an important sort of aspect and context for the work that I did over the last decade or 15 years. Some additional context to give you is that there was also conversations about education reform. So teachers not being paid well, the need for school infrastructure, the focus on test scores and not sort of experiences that kids are having. And I think the important context in the United States is that the public schools or the government schools in the US are the hub for each community. So people sort of buy homes in neighborhoods based on the ratings of the school, of the nearby school, because children go to the nearest public school. Schools are also the sites for the largest public feeding operation. So schools provide breakfast, lunch, after school snacks, and sometimes supper and dinner to students as well. So for many children from low-income families especially, school meals are perhaps the only meal that they'll eat all day because they don't have anything else at home to eat. During the COVID-19 crisis that we're going through right now, schools are again sort of serving as pickup point for meals. School buses are being used for dropping off food in communities. And I think that's an important context to understand the role that schools play in the well-being of the community. So with the childhood obesity epidemic that I mentioned, there was also an increased focus on changes to the school meal programs that are needed to better the food quality, to enforce stricter nutrition guidelines and nutrition education as well. Climate change was another conversation that was sort of coming up, and the need for environmental protection, not just in the US, globally as well. And so this was sort of the context that I was working under. And the easy way to approach this would have been to come up with a program model that improved the quality and appearance of the school lunch tray. But instead, we sort of decided that we wanted to use the school meal program and the school nutrition programs as a strategy for addressing not just childhood obesity, but also influencing education, environment, economic development sectors. And I'll demonstrate to you how we did that. So we dreamt bigger, and we came up with an innovative program model that facilitated cross-sector collaboration. And in the end, we found that this was a more holistic way of approaching multiple issues: a health crisis, agricultural viability questions, economic development, education reform, environmental protection. All of those pieces are possible when you look at it from a cross-sector perspective. So there were small pilot projects that were going on all across the country, and our sort of innovation in thinking was that we brought it all together under one identity called Farm to School. It's pretty simple: farm products going to schools, and then additional things happening at the school level. And we defined the model as having three components that you see here for implementation at the school level and at the community level. Firstly, education, and that could be nutrition education, agriculture education, environmental education, sort of connecting kids with the source of their food, as I mentioned earlier, and an important aspect that society was sort of worried about. And this education could happen inside the classroom, or it could happen outside the classroom as well. So these educational activities were meeting the curriculum standards. So it was not an extra thing that was happening at school, but it was sort of part of what was already needing to happen at school. So using food as a vehicle for teaching math, science, language arts, social studies, history, it's possible, and we were able to do that. The second component was procurement, and this was really focused on prioritizing purchasing of food products for the school meals from local food producers and processors, and supporting local agriculture and economies. It also meant we were reducing food transportation or food miles, and therefore benefiting the environment. And people that were engaged in the school meal program were understanding how and where their food was grown, whether they wanted to prioritize organic foods, or foods with no chemicals or pesticides, or they wanted to specifically look at some seasonal varieties that they wanted to incorporate. So there were options for for schools to sort of localize this program based on where they were. And lastly, school gardens, which meant teaching kids and families to grow food. This also had a huge opportunity for engaging community members. Many times grandparents would come into schools and they knew how to grow food, and so they were able to teach children what they had learned many years back. And then taste tests as well. I found that if kids grow anything, they will pretty much eat anything, be it spinach or broccoli or any kinds of foods that you would perhaps think that kids would not like. They will eat it if they grow it, and that was sort of the framework of the program. So this was the reality of the school lunch tray in the US, and no surprise that school food and school nutrition didn't have a very good reputation or for quality, palatability. I mean, just even looking at the colors here, we don't have the colors that we typically say is good nutrition. So you're seeing nachos with processed cheese, French fries, ketchup, both of which are counted as a vegetable, or were counted as a vegetable, I should say. And canned applesauce. Not much scratch cooking was happening. Schools were either using frozen, reheated, or canned or processed foods. So with the farm to school model, we were able to change from this situation to this. And as you can see, it's colorful. The school lunch tray started looking like this. This was sort of unheard of and unthought of, and there were many naysayers that said that this was not going to be possible within the current system that we were working in. You'll see that there are fresh fruits and vegetables purchased from local farmers, local companies supplying ready products like cornbread or chili or salsa, and then scratch cooking was happening in cafeterias as well. We also had the opportunity through this, through this strategy to elevate the importance of food service professionals and workers, and kind of having them be a key part of the school program. We were also able to introduce culturally appropriate foods into the school lunch menus, which were before that standardized. There was no way for localizing it, but we were able to do that for communities of color, like Latinx communities or African American communities, or Native American tribal communities as well. So we were sort of able to change the kinds of foods that were grown in that area. And how it was grown as well. And as a result of that, able to influence food policy and agriculture policy across the country as well. Here are some examples and pictures that I wanted to share with you. These speak, much more than what I can describe to you that I've seen across the country. kids planting school gardens, students being taken for farm visits. We also saw farmers coming into schools to talk to children about food and agriculture. Students taking pride in their gardens, tasting the food and really eating the food that they were growing, and developing a liking and a palate for it, and then starting small food businesses as well, as a way for as a way for learning what food businesses could look like. We also had culinary instruction, just even starting with the very littlest of kids. And as I've said, I found, and our program found, that when children touch food, feel it, grow it, they will pretty much eat anything if they've had some part to play in growing it. And children were having fun with all of these experiences. We found that kids love stickers, and will do anything for stickers as well. We had developed these stickers and schools were rewarding kids to try out a new food. And they were getting these stickers and they were carrying them all through the day very proudly that they've tried a local food, tried a new food. And through this program, we were sort of improving student nutrition, student knowledge, attitudes, and preferences for healthy local foods. We were also shortening the supply chain and getting more money into the farmer's pocket. And communities were winning as well, because farming and agriculture was sort of investing in the local community. We were reducing food waste, and we were facilitating environmentally friendly behaviors in children as well. So we were calling it our triple win, because this is really a cross-sector approach where kids were winning, farmers were winning, and communities were winning. And in doing this, we were able to partner with researchers to conduct robust research that supported all of these wins. We were able to partner with media to tell the stories of children enjoying foods, farmers benefiting, and communities benefiting as well. And we partnered with funders to seed programs where in areas of the country that we didn't have any programs operational. And so we were able to connect with funders and sort of explain the need for those programs in those areas. And lastly, we partnered with funders to also develop local and state networks and influence legislation so that this program could be something that is available to all communities across the country. We were able to influence policy advocacy. We did a national policy campaign with students and teachers and farmers and food service and parents send in paper plates with the description of the work that they were doing, as well as a description of why they think this is important, to the US Congress to represent the importance of this model. And we had tens of thousands of these paper plates that were going into the Senate and the House representative offices of Washington, DC. We were able to successfully advocate for changes to the child nutrition programs all across the country. And you see here President Obama signing that legislation here. And we were able to secure grant funding from the national government, from the federal government, and in many states as well, to fund farm-to-school sites all across the country. I was also honored to be invited to the White House as a partner of the former First Lady Michelle Obama's Let's Move campaign. That was a proud moment. And all this would not have been possible, if we were not all working together. There's an African proverb that says, if you want to go quickly, you can go alone, but if you want to go far, you should go together. And that proverb was really the backbone of the work that I described, which came together with this organization that I founded called the National Farm-to-School Network. Through a robust network of cross-sector partnerships at the local and the state levels across the country, we were able to gain traction towards our goal. And our goal was to institutionalize farm-to-school efforts in the United States so that these projects are the norm and not an exception. Many of the people that I worked with as staff of the network or partners came to this work from different sectors. I had people that I worked with who were certainly health and nutrition experts and studied nutrition, but also social work, housing, environmental protection, urban planning, rural development, food safety experts, food entrepreneurs, educators, policymakers, communications people. So there was a lot of different kinds of people that came together for this effort. And as you see the numbers here, we were able to, at this point in time, we've about more than half the schools in the United States are implementing this approach. with about 24 million students, benefiting from it. And we've been able to, raise significant amount of money for this work as well. Through this work that I've done over a decade, over the last decade, I also did a lot of fundraising and advocacy for funding and for the program. And I recognize that funders can have a huge influence on program design and development, as well as a huge influence on network building and coalition building and supporting that, because that is often, I find, components of work that are not supported by funders. Funders are also able to work with us on research and policy advocacy, and those are important components as well. And when I'm talking about funders, these are funders that could be private foundations or corporate entities or community foundations or government agencies, as well as individual donors that can provide funds for supporting this kind of work. I've also found that good funders want to see multiple sector impacts, and they want to see unique collaborations and partnerships happen. So, encouraging projects that they're funding to think outside the box, to push the limits further, is something that funders are able to do. And I experienced that, and I really benefited from that as well. Good funders are also true partners, and they want to see your program succeed. But they also want to hear, about your failures. And so, in my work, I've always said, that this is the success that we've had, but these are the challenges and the barriers that we are facing, and we would like to partner with a funder to course correct and learn from our failures. So the funding aspect is what brings me to the work I do now, and happy to share with you my second example with you. So I'm currently the executive director with the Blue Sky Funders Forum, which is a network of funders that are investing in environmental literacy projects and programs that are connecting people with nature. Our goal at Blue Sky is to expand the scope and the amount of funding that is available for the field. And our strategies are to convene funders, to support peer-to-peer learning amongst funders, leverage the power of funders to enable change, and explore collaboration opportunities. So you might ask, what has this got to do with public health nutrition? And let me explain to you the connection here. So the basis of my current work with Blue Sky is based on a pioneering study that was done in 1984 by a professor at the Texas A&M University. The study looked at recovery rates of gallbladder surgery patients in relation to the views from their hospital rooms in a Texas hospital. Some of the patients looked over a garden and a grove of trees, while other patients had the view of the brick wall that you see on the left-hand side of the screen. The study found that patients with a natural view of green spaces spent fewer days in the hospital and used fewer pain medications. This study really helped open the door for a new field of inquiry focused on the ways that nature influences our physical, mental, and social lives. And there is much more data that is now available in the scientific literature that supports the multiple benefits that physical, mental, and social benefits that nature and green spaces have. This sort of field of inquiry and studies have led to what we're seeing now in the United States called Nature RX or nature prescriptions. So this is a move for doctors in established hospitals to prescribe nature, or nature RX as it's called, in conjunction with medication, nutrition, and other aspects of recovery. So that's the context of of the work that I'm doing right now. And being a funder network, we at Blue Sky track funding for the field. And again, recognizing that this is multi-sectoral work, we define and track funding across multiple areas as well: education, conservation, youth development, social justice, and health and wellness. So my goal with Blue Sky is to increase the amount of funding that's available for the field, but also increase it across funders from different impact areas that you see here. So this is a new challenge for me. And my approach to this challenge is similar to what I demonstrated and have accomplished with the first case study that I shared with you with the National Campus School Network. Cross-sector program design, using common language and descriptors for the work that you're doing, network building, capacity building at the local and the state levels, research to really back up the idea of cross-sector outcomes and impacts, policy advocacy, and then securing funds from funders that are part of the network all across the country. The difference is that I'm now primarily working with a group of funders whose investments can really shape the way the field develops and enables change. And previously, I was working with a group of nonprofits and state and local agencies that were supporting our work through the National Founder School Network. So in closing, I'll say that I'm fortunate to have had a variety of experiences in my career. I've worked in a hospital setting and a university setting as a program manager, as a researcher. I've worked with a semi-government entity. I've worked with the United Nations, working in partnership with various government agencies across the region. I've worked with a nonprofit. I've founded a nonprofit, and now I'm working in philanthropy or working with funders. And I've also worked across different sectors, the sector of nutrition, community development, environment, food systems, and health. And all of these are connected, and my hope is that I've been able to demonstrate that for you. And it all started with the training and the rigor that I got at the Food and Nutrition Department at MS University. So a big thank you for that. And one other thing that I wanted to mention was that I've always found that community engagement, something that was mentioned by the previous speaker as well, is a really important aspect of really learning, the practicalities of what you learn in university. And it's been an important aspect of my learning and my journey as well. So while I was studying at MS University, I was active in Friends Society, which is in Fatehganj. And pretty much through my years at MS University, I was very active. And that was in some ways my first try at nonprofit management, and really helped me, create the National Founder School Network, but also, also sort of manage it. I eventually got some training on nonprofit management as well, but the community engagement that I had and the experiences that I had within the community were really important. So the point being that there are many organizations that each one of you can engage in the community depending on your passion or your area of interest, and each one of you can provide some practical, knowledge to them and get some practical learning that will be of use to you as well. So for those of you in the audience that are current students, I will say that the training that you have from the department, there are lots of opportunities ahead of you if you're willing to keep an open mind and go outside of your silo and connect the different dots across different sectors to really think about what lasting change that is benefiting the community can look like. So I wish you all the best ahead in your formal training and in your informal engagement and training with community organizations and community engagement. I'm happy to take questions now, and should also be available via chat to answer some questions if we are short on time. Thank you very much for this opportunity.
Thank you, Anupama, for that very, very interesting presentation. I can see a lot of questions in the Q&A section.